Welcome back, everybody. Well, when it comes to romance, some women think a declining interest is just part of getting older, but that doesn't have to be the case. Genie James is the CEO of Dr. Randolph's Ageless and Wellness Medical Center, and she is helping ladies rekindle the romance in the bedroom.
Absolutely.
Ladies, stop what you're doing right now and come and listen to this
and take notes.
Take notes. So let's get this one topic out of the way. There's a lot of talk about the female Viagra. What is the real scoop on that?
Absolutely, Charlene. In the last couple of weeks, the FDA has once again pushed back the release of a drug called flibanserin because they say they need more clinical trials for what's touted to be the female Viagra. Sprout Pharmaceutical, which is the manufacturer of flibanserin, says they've already done 14 clinical trials with more than 11,000 patients, and they're seeing successful treatment of women with female sexual disorders and dysfunction such as low desire, loss of pleasure, and painful intercourse, but the FDA won't let the drug on the market.
So we'll just have to wait and see when that comes out at this point. Okay, so you mentioned a couple sexual dysfunction issues for women. Is this a real medical issue? Or sometimes they say, oh, it's so much in your head and you need to, you know, relax and focus and not think about the kids. But let's talk about some of these dysfunctional issues.
No, it is a huge medical issue. The statistics show that 40 million Americans live in no-sex, low-sex relationships. And for women, 43% of women say they're suffering from some form of sexual dysfunction, whether it's that lack of desire or loss of pleasure, difficulty in getting orgasm, or painful intercourse. Now, 43% of women compared to 31% of men who say they're having some problems with desire or erectile dysfunction. Now, here's what's really surprising, is that there are 24 drugs on the market today for male sexual dysfunction, but 0 for women.
Oh, wow.
But our good news is...
And then this Viagra's being held up.
Right, but the good news is there are safe, natural options that work better even than the pharmaceutical. So we're going to talk about those too.
Okay, well, let's talk about this. For millions of women, as you mentioned, it's some in their 30s, 40s, 50s, 60s who are suffering from hypoactive sexual disorder or female sexual arousal disorder. Talk a little bit about this. I mean, there's 30s, 40s are already having these issues.
The most common culprit for a loss of sexual desire and pleasure is an age-related loss of your hormones that you need to really function at your best. So as you age, as you move into your 40s and your ovaries can't produce as much estrogen, well, loss of estrogen reduces blood flow to the vaginal area. Your vaginal tissue can thin and become dry, which can cause painful intercourse. Sex shouldn't hurt. It should be a fun thing. You're not into it. The other thing is, as you age and you lose your testosterone, then testosterone is that hormone of desire, right? So testosterone levels, you're in the mood, you're ready for it, but as you age, you move through your 40s and through menopause, you don't have enough testosterone, you don't have enough estrogen, and if you're overweight, you're even in worse trouble because belly fat releases something called sex hormone binding globulin, SHBG, and that sex hormone binding globulin, it's a mouthful, ties up your testosterone like Velcro. So even younger women who are overweight are going to have a problem.
Oh,
it's going to put your sex drive in park.
I did not, you know, if you're overweight, you're not feeling very attractive, but I didn't realize that there was actually something going on. All right, so so an age-related decline in hormones, obviously we've talked about that. That can be a culprit. What about the other things? Because we did mention, you know, stress and, you know, sometimes it's so hard to focus and say, this is the most important thing this evening with my husband because you've got all these other bills to pay and all that other stuff.
Stress zaps that sizzle. I mean, stress causes cortisol levels to go up or down, and an imbalance of your cortisol level at a cellular level is going to take away that sizzle. Younger women also need to be aware that birth control pills with synthetic hormones in them, they also release that sex hormone binding globulin, so younger women on birth control pills are going to have a problem. And then any woman on antidepressant is at risk of having a loss of sexual desire and pleasure.
Wow.
Yeah.
All right, so this was all kind of bad news. So what's the good news,
The good news is you don't have to suffer. No matter your age, you can get the sizzle back in the bedroom and feel really good about yourself as a sexual goddess, as a woman. Bioidentical hormone replacement has been clinically proven for decades to be a safe alternative. When you work with a knowledgeable medical professional, in our clinic we treat tens of thousands of women every year with sexual dysfunction issues and get them feeling like themselves again. We test their levels, we test their blood, we get an individual profile of where they're deficient in their estrogen, progesterone, testosterone, or their cortisol too high or too low, and then we replace with hormones just like the ovaries used to make. So if your body recognizes and receives them, you feel like yourself again. It's safe, effective, there's no side effects with these drugs, these female Viagra drugs that are supposed to be coming out. You're going to get sleepy or dizzy. Let's just get you back to the way you need to be and feeling great.
Right. Now, you actually wrote a book, In the Mood Again. And so what were some of the things that you heard from women?
You know, what really surprised me was that when I talked to women, and they're even young women, when they'd lost their sexual excitement in their day-to-day, or they weren't having regular sex, they really talked about how they lost their self-esteem. It wasn't just like the intimacy with their partner, although they grieved the loss of that in the relationship. But what really stunned me, honestly, was that women in their 60s, 70s, 80s, and beyond who had bioidentical hormones and were still sexually active were reporting overall higher quality of life, more joy, and they felt like they were still pretty. Studies show that sexually active men and women will be healthier, fitter, and live longer. So let's get in the mood again. It's all about your health.
It's all about your health. All right, Jeannie, thank you so much for the information.
Charlotte.
And thanks to Dr. Randolph's Ageless and Wellness Medical Center for sponsoring this segment. For more information or to make an appointment, you can check out the website agelessandwellness.com or give them a call at 904-249-3743.